Dr. Toni Choueiri, Dana-Farber Cancer Institute, Boston. CONTACT-03 was a randomized phase 3 trial to test for the first time in a randomized setting in a large powered population the efficacy and the safety of rechallenging with a PD-L1 inhibitor, atezolizumab, after prior progression and exposure to PD-1 and PD-L1 inhibitors. We found that there was no benefit in terms of progression-free survival, overall survival, and response rate in metastatic kidney cancer, and we found increased toxicity. The control arm was cabozantinib, 60 milligram once a day. The experimental arm is cabozantinib at the same dose plus atezolizumab at the 1200 milligram IV every 3 weeks. Stratification happened by IMDC risk group, histology, and prior setting of immune checkpoint inhibitor. As a reminder on this study, the immune checkpoint inhibitor has to be the last therapy. Response rate were around 40%, whether by independent review and center review, and was identical in both arms, the combination as well as the single arm. Progression-free survival was a bit over 10 months, against identical with a hazard ratio of 1.0. And the overall survival was also identical among both arms, with a median overall survival over 2 years. I can tell you also we conducted subgroup analysis in relevant subgroups, and we found no benefit that can favor the combination: age, gender, IMDC risk score, prior response to immune checkpoint inhibitors, and others. We have accumulated tissue and blood on the study, and surely we will team up with other investigators and the sponsor to look if there's a population that could still benefit from rechallenging with immune checkpoint inhibitors. At this point, I think giving a PD-L1 inhibitor after PD-1 inhibitor may not be right, and I would do single agent TKIs. I think the big difference here, they're very similar in terms of design. The difference is that the experimental agent, if you want, the rechallenge, is not a PD-L1 inhibitor, is a PD-1 inhibitor with nivolumab. The study at the time of the recording of the interview just finished accrual. We believe it does. We believe other trial should attempt to do in a randomized fashion a rechallenge with immune checkpoint inhibitor. We see it in practice. It's not, a standard at all, but I think in tumors where immune checkpoint inhibitor are used, like melanoma, lung cancer, bladder cancer, and other, would love to see a study similar to ours done in other immune checkpoint, in other solid tumor. I think it is possible that the result of CONTACT-03, let's say, was rechallenged with a PD-L1 inhibitor and with atezolizumab, it's possible that they apply to other tumors. We cannot say for sure.